let's look at insurance for a few minutes. From there. What do you think of whenever you hear the word insurance? Healthcare. What else? Just brainstorm. What are something you think of? Money. Yeah, for sure. Do what? Recs, like your car insurance. Doctors. What other kinds of insurance are there?
Like car, house, like your
Car, home, life insurance. For sure, we're going to talk about life insurance a little bit. All kinds of other insurances. Good. Definitely. So what did we say? What's the definition of insurance? What did we say? It's going to be on the end tomorrow.
Financial coverage,
what does it do? You don't have to say
an organization pays for something.
Yeah, right. So they help you to pay for something, right? Financial kind of coverage to help you pay. So, for example, my car insurance. So I pay whatever. Say I pay $30 a month for my car insurance. If I get in a wreck and it does $5,000 worth of damage, okay, I've been paying my car insurance. So even though I'm only paying that $30 a month, they're going to help me cover that $5,000 of damage, right? So that's what it does. Well, how do insurances make money then?
By charging
High rates.
and they get more payment because it's not everyone wreck.
Exactly right, right. So not everybody has a wreck, right? I haven't had a wreck in like 12 years or something. Okay? And even when I did, no.
That's what I would say.
No, right, not common. So, but I still pay my $30 a month. So they, for 12 or however many years I've been driving longer than that. How long? 15, 16 years, I guess. No, 15 years. I'm not that. 15 years I've been driving, so I've been paying insurance all the time. I've had one wreck that probably was, maybe a couple $1,000s worth of damage. I've paid more than that $2,000 over the course of, 15 years. So yeah, that's exactly how they make money. They get, there's a lot of people who sign up for the insurance, and then they use that money to cover the people who actually do need it. So it's kind of a catch-22. It's like you don't really want to pay for it if you don't need it, but if you do need it, you really need it. So that's how that works. So many people, it says in the U.S., are uninsured, and this number has probably drastically gone down in the last few years. Why is that? What do you think? Obamacare, right? So usually I have us research Obamacare, but it's getting, we've had it, it's been around for a while now, so it's not so fresh in news, so I didn't do that this year. But a few things that Obamacare put into place. Obamacare is not an insurance itself, like an insurance program, if you will. And so, or a law. It's called the Affordable Care Act. You may have heard that term on the news as well at some point. But basically what that did was it put some specific laws into effect that really affect our health care and how it's paid for, etc. One thing it did is that it requires everybody to have health insurance. Everybody has to have some kind of health insurance. What happens if they opt to not get health insurance?
They get taxed.
They get taxed. So when it comes time to pay taxes, okay, they pay fines. So what happens when it comes time to pay taxes in April, then they're going to get an extra fee on there for not having insurance. That's what happens. Now the other things that they didn't just say, okay, hey, everybody has to have insurance. They made it supposedly easier to get insurance. So they put into place this called the healthcare marketplace. And basically you go online, I pulled it up a while ago, you go online to, like here's what I did. This is at healthcare.gov. So I just put in like a random, let's say I make $30,000 a year, okay, and we'll say I'm 25. And I'm not a parent, but maybe I smoke. That changes the cost. Why would that change the cost of insurance?
Because you're more likely to get sick.
Right, exactly. It's going to cost more to insure me because there's more of a likelihood that I'm going to get sick. So I want to see, let's see what our plans options are here. Okay, so for me by myself, if I make $30,000 a year, okay, then here's an option. This one is $147 a month. See that word premium? That's the cost of insurance. This one is an HMO. We'll talk about HMOs and PPOs in a minute. Here's another HMO, $155. That's really not too bad. PPOs, if you'll notice, this one's a PPO. No, not still HMO. This one's a PPO. It's $214. Another PPO is $221. They're a little bit more expensive. We'll talk about why in a few minutes. Okay, but so that's another thing that the Affordable Care Act did, was that it put into place this marketplace where you can basically shop for insurances all in one spot. See what's going to work for you, what's the best cost-wise, etc. So that was, let's see what happens if you take out the tobacco use factors. What did I put in, 30,000? Let's say, what did I say, 25? Let's just see if it goes down. Oh, it didn't go down, did it? These went down a little bit, 208, 214, and they were 214 and 220 something. They went down a little bit, but not very much. I was just curious to know. So, anyway, so that's another thing that it did. One of the other things Affordable Care Act did away with was the pre-existing conditions. What does that mean? Any ideas? If I haven't, right, I already had something. So let's say I had an old, let's say I got in a car wreck. Let's say I got in a car wreck 5 years ago, and I have a, I don't know, something. Maybe I have, maybe I had to amputate my leg, and because it got injured or something. Okay, what that means, if I, in the before Affordable Care Act, if I had a pre-existing condition, so when I started getting insurance, I already had that amputated leg, that means my new insurance is not going to cover anything related to that amputated leg. Okay, they would not cover anything. That's a pre-existing condition. But Affordable Care Act says that you cannot not cover things for pre-existing conditions. So under the Affordable Care Act, my employer insurance, like with Cooper High School, who offers insurance, okay, for me, then they would have to cover whatever health problems I had, even if they were related to that amputation. That makes sense? That's what it means by pre-existing. So, what else did it do? There were several things that were involved in it. Okay, so insurance. Oh, well, let's talk for a second about uninsured. Why do you think, why might people still not get insurance? No, it costs too much. If I added 2 children to that insurance cost that we just saw a while ago, it raises it up like $200 to $300 a month. That's a lot. That's another, I mean, that's a big bill every month. You know?
Does that like cover the kids or just you?
That one covered was like one person. Okay, the $150 a month.
Why does having like more people make it like cost more?
Well, that's more possibilities for. Yeah, right. So, and typically your kids, my kids go to the doctor way more than I do. They're always got something going on, some kind of bug, ear infection or something. So yeah, so it definitely costs more. Now, typically an adult though, like for me, a lot of employers help pay for insurance. So like the high school here offers, a specific amount of money that everybody gets to help pay for their health insurance costs. So that decreases the cost for me, for my own. But when I add my kids on, that gets it back up there monthly as far as the monthly cost goes. But if you add a spouse, it's usually way more expensive. Just because you add another adult. So here's what happens a lot of times though. Okay, so everybody heard of Medicaid. Medicaid is an insurance, and I'll write this down in a minute. That is, it's a government insurance plan, and it's specifically offered to people who make under a certain amount of money. So it's income based. And I don't know in Texas even what the yearly income is, or month. It's a monthly income that you have to make less than that. But that's what allows someone to qualify for Medicaid. So you have people who make, less than that income so that they qualify for Medicaid. And then you have people who work at like an employer, somewhere that offers insurance that can afford the insurance cost. But then there's a pretty good little gap of people in the middle who make too much money to qualify for Medicaid, but don't really make enough money every month to be able to afford insurance. I mean, insurance is expensive, like we just saw. And so that's where you see the uninsured people. And so that was one of the things that I think with Obamacare, that they're trying to get rid of that gap, because the uninsured really drive up the cost of health care. Why would they do that?
It's just extra people that aren't paying the insurance.
Right. So, people who fall into that gap are still having babies. They still have health problems, right? They still need health care, but they can't afford it. That cost has to be made up somewhere. So health insurances themselves go up. The cost of health care goes up. Everything goes up.
And it's going to really make them want just for insurance.
Right. Well, and that's part of the issue is, if the money that people make doesn't change and go up every year, then how are they, just because you force people to buy insurance, it doesn't mean that they can afford it, So I don't, there's roots of issues that go way down deeper than just Obamacare or anything else, that's an attempt to fix a lot of that gap, and it has given a lot of people insurance that probably didn't have it before. So, there's good and bad, and that's for every situation, everything like that, a program like that. There's going to be good things and bad things that come out of it. But the uninsured, that group, because they go to the emergency room, they're having a heart attack, the emergency room is still going to make them better, whether they can afford it at the end of the day or not. And so, that's where a lot of that comes from. That's where a lot of the cost of healthcare has really gone up. Okay, so insurance, the purpose of insurance is to decrease out-of-pocket expenses for healthcare services, right? So I pay X amount per month, and if I need surgery or if I need something big that comes along, they'll help me pay for it. And depending on how much you pay per month, that kind of depends on how much coverage you get. If I pay more insurance, I should have to pay less when a doctor visit comes up or something else, right? In theory. Okay, so companies purchase health insurance for employees. And that is another part of the Affordable Care Act that's required, except for really like small businesses that only hire, a few, very small number of people. Everybody else who hires people has to offer health insurance. It doesn't have to be good health insurance, but it does have to be health insurance. So eligibility usually depends on their continuous employment, right? So I might have to commit to sign a contract for a year or something before it works, or something along those lines. Employees must work 20 or more hours. Usually to receive benefits or receive health insurance, you have to work at least half-time, but a lot of places require that you work at least full-time. Most companies have a waiting period, so if let's say I start working today, maybe I have to work for 3 months before the health insurance will really cover anything. That's what that waiting period is talking about. And I've worked at places like that where you couldn't use your health insurance for the first 3 months. And then pre-existing conditions might be ineligible, but that's not really the case anymore. Okay, HMO and PPO, these are two of your words for the vocabulary quiz on Friday. HMO stands for Health Maintenance Organization. So this is managed care. Remember that M is health maintenance, but it means managed care. What does managed care sound like it might mean? Do what? hospice, so it could include hospice. But if somebody says you're going to be in a managed care plan, what does that sound like?
They help you manage, like you manage, or money.
Managed care means that they manage your care. You don't necessarily manage your care. They manage it for you. So they have a specific doctor for you to go to. If you need to go to a specialist, they have to approve you going to a specialist. If you want to have surgery or need surgery, they have to approve it before they'll pay for it. They manage your care. Now, these are usually cheaper for employers. Cheaper, you notice the HMOs were cheaper on that. Okay? That's because they usually offer a little bit more limited services. They require that it goes through this lengthy process before they'll cover whatever it is. So let's say I wanted to go to a dermatologist. Well, that's a specialist. I have to go to my primary doctor first and then get a written referral to go to a dermatologist. That's a referral. They send me, like the primary doctor sent me to a dermatologist. Everybody know what a dermatologist is? Can't talk about it. Okay. So that's an example of managed care. And they can say no. They may not approve it. If they don't approve it, they won't cover it. Specialty treatment is available with a referral, like I said. Usually the primary physician provides all the care or refers them out. Has to be approved. Okay, PPO stands for Preferred Provider Organization. What does that sound like it might mean? You choose, right? You pick the provider that you prefer. So usually physicians contract services. So let's take Blue Cross Blue Shield for example. Okay, so they have worked out contracts with physicians for care. So let's say like at the PCA. I mean, that's part of the PCA and here it is. The pediatric clinic there. So they have, PCA has, a list of insurances that they've already contracted with for a service. So a regular doctor's visit, they may have contracted the price of $85. So they got together with Blue Cross and said, Blue Cross said, we'll pay you $85 per doctor's visit. And they said, okay, well, that'll be part of our contract. So when I have Blue Cross Blue Shield insurance, I take it there. And when I take my kids to the doctor, they can only charge me that $85 because they've already contracted that price. Make sense? But I still get to choose. I can go to whatever doctor I want. And the same thing with the specialist. For most of the time, I can call up the dermatologist and make an appointment. Once they take the insurance, I can go to whoever I want to. I don't have to have a referral and get it approved and just get the process. Okay, let's go over the vocabulary real quick. You guys are going to want to write this stuff down. This is going to be on your quiz Friday, so you might find a place on your notes to write down, or these are listed out on your weekly for today as well. That's what will be on there. Friday, the insurance vocabulary quiz. Okay. All right, let's go over these. So we'll talk about disability in just a little bit. We talked about HMO and PPO. We'll go over a couple other things first, and we'll come back to OPA. Let's talk about the word deductible. Actually, change my mind. Let's talk about premium first. What is your premium? You may know? Do what? Yes, premium is the price or the cost of your insurance. Okay? The price or the cost of the insurance itself. Okay, so every month when I get my paycheck, there's a one that says insurance, and it comes right out of there. And that's what I pay. That's what the insurance costs me. So price or cost of the insurance. That's my premium. Okay, now that's separate from what they're going to cover, what I'm going to have to pay to the doctor, all of that. Just goes to insurance. Okay, the next word I want us to learn is deductible. Y'all heard that word before?
Yeah.
I watched the state. Is that state? An all-state commercial with English deductible. We heard that on TV.
Use a really deep voice.
Yes.
The one with the little girl and the dad, like he gets in a wreck and all of a sudden the little girl starts talking to her dad in a deep voice. I crack up every time.
I like the one with the guy in the, what does he have, like a Mustang or something, and it looks like his big baby, you know? Oh,
Yeah.
gosh. Okay, so what is deductible?
What you have to pay.
But it was
What
like
you have
what
to
they
pay out of
take
money.
out.
What they
If
take
you get in
out.
a wreck, what you need to pay out of your account.
Okay, good. Y'all are good. Okay, so your deductible is what you pay before your benefits really begin. Okay, so word this like I did on here. What you pay first before full. Oh, my handwriting is crazy as I go throughout the day. Before full benefits begin. Okay, so for example, like car insurance deductible, okay, usually it's like $500. If I get in a wreck, I have to pay that $500, but then they're going to cover the rest of it. And usually that's good for like the whole year. Usually your deductible lasts for a year. So let's say I have a C-section, okay? My last C-section, somewhere around $35,000 is the total cost of a C-section. By the time you add in the anesthesiologist and the doctors and the baby doctor and the hospital and all this stuff. Okay, let's say my deductible was $5,000. Okay. Which I think my deductible is actually more than that. So, let's say my deductible was $5,000. That means I have to pay that first before they're going to cover anything else. So the deductible is still my part to pay. Okay, so that's still what's left at this point. We'll get to the rest of it in a minute. But that's that kind of initial thing that you pay before your benefits really start. Now, different insurances are, you know, it depends on what kind of insurance you have as to you have to pay your deductible first or what goes on. But usually that's the first thing. Like if you have a surgery or something, you have to pay that deductible first. Okay, now let's go back to, actually we'll go on, let's do copay next. We're talking about paying stuff or copayment. You guys have probably seen, if you've ever looked at an insurance card, you might have seen the word copay on there or probably heard that word at some point before. And I would encourage you guys tonight, you know, whenever you get home, look at your insurance cards, or if you're on Medicaid, look at your Medicaid card. What all does it have on it? What does it say? You know, does it say what will be covered and what's not covered? Look at it. Look at it. It's very good. Okay, so a co-payment is a set dollar amount that you pay for a service. It's a set dollar amount that you pay for a service. Here's say we're going to get into groups and look at, we're going to work out some insurance. Okay, so for example, let's say on your insurance card it says copay, usually it will say primary doctor, $25. That means you pay, you just pay $25. That's all you have to pay. Okay. Maybe for a specialist it might be $50. So it means that's, you just pay that $50. That's the deal. You don't worry about deductible and all that other stuff. Sometimes you have to really watch. This is going all the way out for you guys, but sometimes you have to really watch. Sometimes your co-payments don't actually apply towards your deductible. For example, so for example, when I had my first baby, I had $150 a day co-pay to the hospital. That meant I was in there for 3 days. Okay, so it was $150 a day. So how much was my hospital co-pay? 450. Right? So well, then the baby was born, and the baby had to pay $150 a day as well. They had a $150 copay as well. So now what's my copay? Another $450. So how much do I have to pay in copays? 450 is 900. Well, unfortunately, during that time, that $900 copay did not apply towards that out-of-pocket. So I had to pay all of my out-of-pocket fees plus the $900. I didn't really know that before. Didn't know that. I didn't know the second time. Okay. But sometimes you have to watch because those can be in addition to, or they can be part of what you have to do. But I think. I'm sure you guys will remember that whenever you do jobs. Yes.
They are like, bond insurance is $20 for doctors and $100 for the hospital. Why would they put that big of a difference between the doctor and the hospital?
Because doctor's visit in general costs much less than the hospital. Like you have to go to the emergency room, a lot of times they might say $100 or $100, $150 for emergency. But you got more staff who work in a hospital that have to be paid. The bills themselves are more expensive. You got more equipment, all of that. So hospital, you have to get extra. That's much cheaper to go to the doctor's office instead of going to the emergency. Which is another reason why Affordable Care Act was put in place. People out of the emergency room where it costs much more in health care than at the doctor's office. If people don't have health insurance, they just go to the emergency room. They have to care for them. Right? And that drives up the cost of health care too. So go to the doctor's office first. If you can. I mean, obviously, we all need the emergency room sometimes, but it's cheaper to go to the doctor's office for colds or just general illness than it is to go to the emergency room. Okay, co-insurance. This is a percentage paid for a service. Keyword there is percentage. This co-payment is a set dollar amount and co-insurance percentage. Okay, so this, for example, like in my situation here, we had to pay 20% co-insurance. That means that after we paid our deductible, we started to pay 20% of what was left. We didn't have to pay 100%. We had to pay 100% until we met that deductible. We had to pay 20% after that, and that's the co-insurance. So what would 20% of 30,000 be? Let me teach you a little math secret. Teach you a little math secret.
7,500.
Look, that'll be guessing. Let me teach you a little math secret. 20% is how much out of 100? 100 divided by 20 is what? 5. Right? What's on y'all's? In case you don't use the calculator too much. Okay, 30,000 divided by 5. Look, take away these zeros. 30 divided by 5 is what? You know that one, right? 6. Drop your zeros down. 6,000. There you go. 20%.
Oh, wow.
Okay. It's a good way to figure out. If you're looking at sales, okay, and shopping, and you're like, oh yeah, this is 20% off. Just divide it by 5. Take that away from it. It's $10. Divided by 5 is 2. 10 minus 2 is 8. Not skill there. Okay. So 6,000, okay, is what would be, that would be my co-insurance. That would be what I'd have to pay. Okay, that's a percentage that you have to pay. Okay. Okay, let's look at Medicare and Medicaid. Medicare is what? Who is it for?
People who can't afford insurance.
You got it
Older
backwards.
senior citizens.
Medicare is for the elderly. the elderly. Okay, so Medicare is a health insurance plan for the disabled or for people over the age of what?
65.
65 who have
Authorized.
worked. How is this one funded? Anybody know? Federal or state? Federal. Okay, so key things are health insurance plan for the disabled or for people over 65 who have worked. Do it.
He said for people who have arthritis.
Well, if they're disabled, then sure.
We were in Del Rio.
So, most people over 65 have some kind of arthritis.
We were in Del Rio. And Bill was over 65.
A lot of people
And
before they get
James was
65
like
have
talking
arthritis.
about his Medicare. We were like, oh, you don't work that old. He was like, oh, blah, blah, blah.
So,
Sure.
So keywords here: one, disabled or 65 who have worked. Usually, or at least it used to be. I'm sure it's the same. They have to have worked 40 units, which means usually it's like 40 quarters. So 10 years basically. They have to have put into Medicare in order to get it back when they turn 65. Now, people can if their spouse has worked, a lot of people can draw off of it on their spouse as well. So, like if somebody didn't work but their spouse did, they can still get on Medicare. Disabled, they still have to have worked to get on disability and for Medicare to cover that. And it's usually like a 2-year process. It takes a long time for all that to go through. But that's that. 65 who have worked at least that 10-year time period. Now, children can get on Medicare sometimes too. I don't know exactly what all the situations are, but if they have some kind of, if they've had like a long-term issue, like they were born with a health problem or something like that, sometimes kids can get on Medicare as well. It has to be some kind of chronic issue usually. Okay, what about Medicaid?
Government funded insurance for people who can't afford insurance.
Right. So this is a health insurance plan. Specifically, let me see how I worded it on here, so make sure I worded correctly. For people whose income is below a certain amount. And I don't know what that amount is in Texas right now. But, so health insurance plan for people whose income is below a certain amount. Okay, and this one is state funded. So each state determines, the amount of income. And that makes sense because in general, the cost of living in Texas is a lot different than the cost of living in like California. So it makes sense that this is state funded because it's income based and not work based or whatever. So health insurance plan for people. Now, when CHIP, which is the Children's Health Insurance Program, is kind of a children's Medicaid, if you will, and there's also children's Medicaid. That usually, your family can make more money and qualify for children's health insurance program like children's Medicaid than they can for like adult Medicaid. That makes sense. The family can make more money and still qualify for children's Medicaid than for adult and still qualify for it. No. But these are both the same. So like every month on my paycheck, there's a little spot that says pay my Medicare tax, and that comes out of my check. And it's the same thing for Medicaid. There's a place where my Medicaid tax comes out, and that's what pays for Medicaid. Okay? That comes out of paychecks. So that's where a lot of that money is built. And that's why, we talked about the baby boomers. I don't know if we talked about baby boomers. We might have skipped that. No, we talked about that, didn't we? Baby boomers in here. I can't remember. Maybe we missed it because y'all had missed. Yeah, because y'all missed that one day to go to that meeting. But anyways, baby boomers are a generation, I think, born between 47 and 64. that are, it's like our largest number of people in that population age range because the economy was doing really well after World War II, so people have more babies, had really large families during that time. Like my dad's one of 7, families generally speaking were bigger back then. And so that group is all getting to this age right now, which is kind of a problem. So we have this huge number of people who are drawing Medicare, but not as many people who are working and paying into it. So that's always a big concern when you start talking about presidential elections and things like that. Social Security is the same way. So, do what? Oh my goodness. We're gonna have an ethical debate pretty soon too. I'm not sure if I'm gonna let you in on that.
She's only 10.
And my aunt's gonna 23.
Yeah, so okay, that's great. Okay, let's keep on going. Cobra, written on here. Okay, Cobra is a month-to-month insurance plan. For a person that's become unemployed. Okay, so a month-to-month insurance plan for a person that has become unemployed. So, working at the school, say I quit today, okay? The high school has to, or Cobra ISD has to continue to offer me health insurance. So they don't have to keep paying for their portion. I would have to pay the whole thing. But they have to offer that for at least like 30 or 60 days after I quit working. And that's Cobra. I can take it out, but it's month to month. If I don't pay my premium this month, then I'm done with it. And it goes month to month. It's not like a contract like what we have now. So that's Cobra. Beneficiary. What's a beneficiary?
Someone that's over all your financial
Okay. They could be.
stuff either after you pass or